Group 3 of mental health conducted a review of coping mechanisms used by young adults for various stressors. We saw that stress is the body's response to physical, mental, or emotional pressure, and perceived stress causes chemical changes within the body that alters various bodily functions, including heart rate, blood pressure, or blood sugar levels. It also alters feelings and experience of emotion, including anxiety, anger, frustration, rage, or depression. In order to combat stress, certain coping mechanisms are employed. A coping mechanism is any conscious or non-conscious adjustment or adaptation that decreases tension and anxiety in a stressful experience. There are two overarching coping strategies for stressors, one of them being problem-focused, which involves dealing with the issue itself in order to reduce stress and dealing with the direct stressor, whereas emotion-focused mechanisms assist the individual in dealing with the negative emotions and feelings that result from the issue as opposed to the stressor itself.
So to give a little bit of history into stress and coping research, Hans Selye introduced stress as a response model in 1956. He was a Hungarian-Canadian endocrinologist. His stress model was based on physiology and psychobiology known as general adaptation syndrome. His model states that an event that threatens an organism's well-being, aka a stressor, leads to a three-stage bodily response. Stage 1 is alarm, stage 2 is resistance, and stage 3 is exhaustion. So Lazarus and Folkman later on created the transactional theory of stress and coping. It explains stress as a dynamic process. This theory presents stress as a product of a transaction between a person and their complex environment. Later in 1984, they expanded their model to include primary and secondary appraisal. Primary appraisal deals with the situation and how you interpret it. Secondary appraisal involves evaluating your resources or coping strategies to deal with any perceived threats. Unlike other theories where stages come one after the other, these happen simultaneously. To give a little background into cultural studies, one that was conducted in undergraduate university students in India and Canada. The results from this study concluded that the difference between stress and coping boils down to broad cultural factors. While Western societies put an emphasis on individualism, Eastern societies have a more collectivist culture. The family unit is the focal point for the social structure in Eastern culture. Another study that was done in China on adolescents that examined stress, coping, and problem behaviors. The same could be said for this study as well. Similarly to India, expectations and pressure from family members is common in Chinese culture.
When it comes to coping mechanisms for college students, there are also collectivist and individualistic cultural ideals where the coping mechanisms tie in with these cultural ideals. Universally, the coping mechanisms are necessary in response to the additional strain and workload, which results from the transition to college, which is a major point of an individual's life. These coping mechanisms can either be positive or negative depending on the levels of stress. It was seen that for college students, common stressors included financial strain of higher education, pressure to perform excellently, helplessness due to a lack of family support, and an increased workload from their educational demands. When it comes to common coping mechanisms that the college students employed, when looking at individualist cultures, the coping mechanisms that were employed were more social, including moderate alcohol consumption, as well as risky sexual behavior and other social activity. Whereas in collectivist cultures like Hong Kong and Pakistan, music and exercise was seen as more predominant coping mechanisms, as well as communication with the support system and time management to combat the various stressors. However, certain maladaptive coping mechanisms like smoking were also employed. Interestingly enough, both cultures showed personal religiosity and a future time perspective. This means that if a person had a personal religious belief, they were more likely to have efficient coping mechanisms, and individuals who had a positive outlook on the future were also seen to have a more effective coping mechanism. From all of the papers that were reviewed and all of the research that was studied for this paper, it was seen that females show higher stress levels and higher physical symptoms like headaches and elevated heart rate. Females also use emotion-focused coping mechanisms to combat the feelings associated with the stress instead of the stressor itself, while males use problem-focused coping mechanisms and combat the stressor directly. When it comes to collectivist versus individualistic cultures, collectivist coping mechanisms are seen to be tethered to a strong support system, communication with the support system, and time management, and are overall more positive adaptive coping mechanisms, whereas individualist coping mechanisms are more recreational and social and include alcohol consumption and drug use. Both cultures and genders, however, do show some amount of positive adaptive coping mechanisms when it comes to personal religiosity and future prospects. So when a person has strong religious beliefs or a positive outlook of the future, regardless of the collectivist or individualistic nature of their culture, they are seen to have better coping mechanisms.
So why is this research important? Because stress is a universal experience and the way we cope is greatly influenced by our environment. Culture and gender play a role in the coping mechanisms we use. Learning healthy coping skills is important because it teaches us how to deal with difficult situations and helps us to become more resilient. So whatever problem comes our way in the future, we have the strength and willpower to keep moving.
Thank you.